think it's important to not create this chasm between the practitioner and the patient. We're all patients in this work. Mental health touches 100% of us. And it's not something that we need to, I think, alienate each other and say, like, I'm the professional and you're the one who's the patient. You need to listen to me. Like, no, I'm learning just as much as anybody else. So I think it's important to acknowledge that as doctors. We need to practice what we preach. If I had a loved one or myself, if I was feeling very deeply depressed, like I probably wouldn't run to an SSRI. And with my patients, I'm very honest about that. The data justifies the fact that SSRIs are probably going to, more often than not, cause more harm than good. If you're lucky and you're one of the small proportion of people that it works well for, it may be life-saving. I don't want to overlook that. But for the majority, it's been harming people and not helping them. And so I wouldn't run to Prozac if I was having a hard time. That speaks to the shift in the medical model, is that now there's medicine out there that I don't think is creating as much damage as we've seen before. And because of that, it feels safer to partake and to gain benefit from. So I hope that we start to see more experiential medicine rather than just passive meds where it's like, take this pill every day and maybe things will get better. That scares me a little bit. What's actually happening? The scientists don't know 100%. And so my patient who's trying to learn from me and I'm trying to educate the best I can, I have to be honest about the limitations of what we don't know.
Welcome back to another episode of the Burning Bear podcast. Man, does it feel good to be back with you guys. I know I've been gone for a little bit. Work had me pulled away. I was working with the VFW on the TCAVA bill in Section 108. You guys may have known about that if you're following the veteran information out there online and watching veteran news. The Grunt Style Foundation and Irreverent Warriors worked together with the VFW, and we got a hold on that bill. And hopefully I'll have an update for you on that shortly. But that little stint in D.C. landed me with the VFW at their national conference in Reno, Nevada. And I was asked to be a part of a psychedelic panel there. And I got to meet some very wonderful people all throughout the VFW. But my panel members particularly impressed me at this conference, and I have invited one of them here with us today. I would like you guys to say hello to Dr. Sam Zand. How are you doing today, sir?
Good. Thanks for having me on. It's nice to talk after we just met last week at the conference.
Absolutely. Yeah, I know we only got to speak briefly at the conference, so this is going to be our get to know each other conversation. Why don't you start out by taking a moment and just telling the audience about who you are, what your credentials are, and what you do for a living?
Absolutely. So I'm a psychiatrist, and interestingly enough, when I was on the panel with you last week, I heard other people saying, like, do we really want a psychiatrist on this panel? And that I think speaks loudly to the point of why we're having this conversation, is to understand, why is psychiatry so stigmatized? What did we do wrong for so many years? And now what are we doing right? And I think there's some excitement in my field. I actually teach psychedelic therapy at several universities. I have a national psychiatry practice called Anywhere Clinic, where we teach our clinicians really holistic methods about how to really help somebody in their mental health. And it's not just throw more medications at them, tell them they need more therapy. There's so much more. I think that when we really want to help each other understand ourselves, understand the journey we've been on, the stories we tell ourselves, the way we're wired, our nervous system, our brain patterns. I mean, this is the wild frontier of medicine. And so I think it's an exciting time where we're actually using some ancient technologies, bringing in some newer technologies, and trying to find healing and growth amongst the community that needs it so much.
Well, that is awesome. And I am definitely one of those guys that raised their hand and was like, why do we have a psychiatrist here? Here's the deal. I study a lot of psychology. I use a lot of cognitive behavioral therapy and things of that nature. So I don't dismiss the world of psychology. I think where I've had issues with the clinical setting of psychedelics is usually where I have fallen off. But I was very impressed by you, the conversations and the methodology that you kind of brought to the table. And that was one of the reasons why I reached out to you, because I thought, wow, I was shocked that I was as receptive as I was in this space. And so I appreciate what you're doing and where you come from, and definitely have a lot of respect for you in the field and what you're doing. My biggest question for you is, did you always start as a psychedelic psychologist, or was this something that you evolved into?
Yeah, well, I did my undergraduate training in public health at Johns Hopkins, and they were doing a lot of psilocybin research back then. I'm not saying I was a pivotal part of that, but it was exposure early on that kind of showed me like, oh, there's something here. But it really wasn't until FDA approved Spravato as ketamine, the nasal spray, that I started to learn more about a new type of medicine, right? No one has ever told us before there's a medicine that you can take once weekly for your depression. There's a medicine that you can take that might actually help suicidality overnight. And this was all brand new to me. So while I was young in my career, learning that, COVID struck and our offices closed. We had about 10 offices. And so we had to figure out, what do we want to do with all of our resources? And we really invested in understanding ketamine therapy, Spravato, but we're still building the foundation, I think, for the medical model to embrace this kind of care and to not let big pharma run away with it in a way that really isn't helping people. You know, I know big pharma is kind of like the enemy to a lot of us, but we've got to play with them, right? We're on the same team. We're trying to help people get better. And although it feels adversarial, I think a lot of our industries, we feel that jaded, you know, are we doing the right thing kind of perspective, psychiatry, pharmaceuticals, even the veteran community. You know, I work with so many deeply who the story changes and shifts with the manipulation and the politics and all of the layers that really take away, you know, what we're trying to do. In my field, we're trying to help people find peace, clarity, and happiness. And in the veteran community, we're trying to protect, right? We're trying to find peace in the world. Pharmaceuticals, we're trying to help people with medicine and not hurt them. But unfortunately, all three of those industries have been tarnished in different ways. And so I think we're really trying to come together and figure out, how can we serve this community with these tools in a medical model that actually works.
Absolutely. Yeah, I agree with that. You know, we have at the foundation, we have a big push, the Work Right for Change, where we are pushing against SSRIs and the cocktail of drugs that soldiers are receiving, that come with so many side effects. And one of those side effects is suicidal ideation, which is the whole reason why a lot of these soldiers are there to begin with. And it's like, I don't understand how putting a loaded gun into somebody's hand is the best way to solve this problem, but that seems to be the current methodology on it. And here's a question, because even though here we are on a psychedelic podcast, I've never done ketamine. I actually don't know that much about ketamine. Could you educate me and my audience on what ketamine is and how it's used?
Yeah, absolutely. So I'll start by saying it is the number one treatment tool that I think we have in psychiatry right now. We treat over 20, 30,000 people nationally. And for those who it is an appropriate treatment, they don't have medical reasons why they shouldn't do it, I'm encouraging it. I think that we all need to have this experience. And if you look at the history, ketamine's been around for 60 years or so. It was first brought to market as an anesthetic, and still to this day is being used as an anesthetic for young children, for surgical and operative procedures where we don't want to create respiratory depression. We don't want to lower someone's breathing rate. Ketamine is used as a dissociative anesthetic so that it actually separates the mind from the body. At high doses, you're consciously aware. You might be in another galaxy, right? And that's the psychedelic element, but you're alert, you're there. And while they're doing surgery, they don't need to, monitor your breathing. They don't need to monitor your heart. It has a very benign effect on the body. It can increase blood pressure and heart rate a little bit. So 50 years ago, they're using this anesthetic in the fields, and Vietnam actually is where we started to see psychiatrists of the 60s, 70s. We're seeing that soldiers who were given ketamine for operative procedures, for nothing else. There was no talk of PTSD, no talk of therapy. They were just given ketamine because they had a procedure. Following them afterwards, we actually saw a lower incidence of PTSD, of trauma type symptoms. And so that really sparked something for the community, where we started to learn then that this neuroplasticity, which your audience probably understands with all psychedelic medicines, it shares that property. Ketamine creates new neurons, creates new neural patterns in the brain. And when we use it at low doses, whether it's an oral absorption lozenge or it's a nasal spray, it's also very popular to go into the clinic and get an injection or an IV. Still in the lower dose range, we're not putting anybody on a surgical dose. It creates a little bit of a relaxation effect, a nervous system reset. That's what's unique about ketamine. Those who might be experienced or well-versed in psilocybin, when you're on psilocybin and you're having a mind-expansive experience, you're present to your body, to yourself, and you want to move, you want to engage in nature, you want to hike. With ketamine, it is somewhat of an out-of-body experience. You're disconnected from yourself, and therefore you get this kind of reset, this I am not myself, I am observing myself type of feeling, and it's very difficult to explain, but that's the hallmark of ketamine, and that's where I think it uniquely has something additional that it does for us, in that it gives us that mind expansion. It gives us this new perspective shift, but it also moves us out of our feeling of self, even if only for 30 minutes. And when you come back, you start to have that what just happened kind of feeling. I was seeing myself from an external perspective, less emotional charge, less of the patterns that weigh me down, and more of a blank canvas. And so we're using it now pretty broadly through at-home treatments when appropriate, as a lozenge, or in the clinic as a nasal spray or injection. And it's done once weekly for the most part. So it's not something you take every day. You have this experience that lasts about 30, 40 minutes. The come down might be an hour or two. And then you're kind of feeling physically back to yourself within that 1 to 2 hours, which is really nice. The short half-life compares well to the other psychedelics. So for many reasons, I think the final thing to say about it is that it's legal, it's prescribable, it's a Schedule III drug, and so any doctor in any state can prescribe it if they're trained and well-versed in the protocols.
Okay. Yeah, well, that explains a lot. My friend Chad over at Mental Joe, he started in the ketamine space. That was his big beginning and kind of kicked him over. And, I have a lot of experience with ayahuasca and psilocybin. I do most of my work specifically with psilocybin. And my first question that I had when you were talking is because you were talking about the out of body, which I kind of relate to DMT. In my personal experience, psilocybin kind of keeps you in your own mind. Even though you go into that large, expansive subconscious mind, there is definitely something different about what psilocybin and even a heroic dose of psilocybin versus something like ayahuasca with the DMT. Is ketamine closer to the DMT experience? And if so, what is the main chemical that's producing that, and what region of the brain is activating that's allowing that to happen?
Yeah. So the great thing about ketamine is that we can use it on a spectrum. At a very, very, very low dose, it's so mild that it almost just feels like a meditation. I had a patient who was a police officer, and he said, I really don't want to do anything that's illegal. I don't really want to lose control of my mind. And he did have some experience with yoga and meditation. And he said, but it was very difficult for him. He has these yoga sessions and he just doesn't feel very comfortable. He does these auditory meditations and it's really hard for him to get into that groove. But with a low dose ketamine, he came back and said that was just like a cheat code. I felt like I was just meditating and I didn't even have to try. And so at a low dose, it's quite relaxing and meditative. At higher doses is when it becomes more psychedelic, more out of body. And so similar to, any drug, the dose makes a big difference. But I think the misnomer is that, we're all going to K-hole and it's going to be this crazy experience where you're stuck in the couch. And actually, at a low dose, it's very gentle. We use it for elderly patients. We use it for young children and different reasons. So, I don't want people to think that it's this crazy out of body experience. It can be if you give it a little bit of time to acclimate to a higher dose, but at low doses, it's very gentle. And you were asking about the mechanics of it. What it actually is working on is a neurotransmitter in the brain called glutamate. And the audience may be familiar with serotonin. We thought serotonin was our happy chemical. 70 years later, we realized we probably weren't even on target with this as the primary neurotransmitter that modulates mood. we know it does contribute. What glutamate does is it's the accelerator on on the neurons in the brain. So if you think of GABA as another neurotransmitter, people might have heard of a medicine called gabapentin, or even alcohol or Xanax. They actually hit the GABA receptors. That's the brakes on the nervous system. It slows us down. It too much brakes, all of a sudden we have dementia, right? We can't think clearly. Too much gas, all of a sudden we're manic and we're amped up and we're super anxious. The glutamate GABA relationship is very delicate in the brain. And so what glutamate is doing is it's saying, let's create more neurons, let's create more connections. And when we do that in the right dosage, it's like fertilizer for the brain, allowing the creation of new neuronal connections.
Okay. Okay. So let's make sure that I'm following up to this point. It sounds like to me, so I do take GABA, I supplement GABA, and I actually use it in my microdosing protocols because I follow the Stamets protocol most of the time when I'm doing a microdosing regimen. And you mentioned serotonin. One of the things that surprised me is I had to stop taking 5-HTP because of its relation to serotonin when I'm microdosing. And does ketamine have that same issue where it's impacting serotonin receptors?
So if somebody is on an SSRI or taking something like 5-HTP, they can stay on it. Ketamine was actually trialed with an antidepressant. So when Johnson & Johnson brought it out, FDA approved in 2019, it was actually said to be an augmentation. You had to take it with an antidepressant. I had patients coming to me saying, we're trying to get me off of this antidepressant. Why do I have to be on it? And I'm like, because your insurance requires it. But it's because the initial trial was only with antidepressants. They did another trial a few years later, and now it's approved as a monotherapy. So the good news is that those who are on antidepressants, that 30% or so who still kind of find benefit from those medicines, they can stay on it. Unlike psilocybin, which we would talk about tapering down and avoiding serotonin syndrome, ketamine plays well with serotonin.
Can you also take GABA with it, or does that upset that balance?
Yeah, that's an interesting question. And the truth is, it's such a delicate balance that it can affect it. What we see, though, clinically, a lot of our patients are on gabapentin. It just kind of dampens the experience. And it doesn't mean that it's a dangerous interaction. It doesn't mean it doesn't work. Sometimes it means we need a little bit of a higher dose. And that's what we clinically decide, when we look at a patient, what medicines they're on.
Okay, well, you had me very interested because you mentioned earlier that it helps with meditation, and that happens to be like my kryptonite. My brain goes 24/7, and no matter how much mindfulness I have given it, it's not that I'm not capable of doing a good meditative session, but it is very difficult. This is like a max bench press for me. It's not an easy activity for me to get into. Would you recommend somebody like myself that's looking to get into an easier, deeper meditation? I've used cannabis many times, and cannabis works, but I'm embarrassingly have to admit, usually I end up falling asleep at some point, where I get a little too relaxed into the cannabis train. So would you recommend that for somebody like myself?
Absolutely. You alluded to feeling like it's a max bench press, right? This is like having, the world's strongest spotter helping you out. It's really helping you lift that up more easily. You just kind of fall into that meditative experience. Cannabis, I think, is a great drug if we use it intentionally the right way. And it has its own spectrum of pharmacology, all over the place. But with cannabis, it's a little bit more sparking creativity, enhancing focus sometimes. With ketamine, it's more like clearing all the space, and just deleting the cache, right? Deleting all of the clutter so that now focus is there because nothing else is, right? And that's really what meditation is about. So I actually think that this is the best medication-enhanced meditation tool that we have.
Okay, well, I think you've convinced me. This is something I'm going to have to give a try. And so here's my next question then, if I can remember my train of thought. But when I take psilocybin, one of the things that turns me off on psilocybin is the upset stomach. Even when I use like a lemon tech, there's a transition that occurs from the time that the psilocybin is ingested to the time that it kicks in that I don't enjoy very much. I don't get that on microdosing, but anytime I take a larger dose, that's there. Is there anything like that with ketamine?
Yeah, I would say about 5 to 10% of people do experience nausea, but that's much less compared to psilocybin. And the reason is psilocybin is this burst of serotonin. And not only do we have serotonin receptors in the brain, but we also have serotonin receptors in the gut. And that's why we experience that queasiness on psilocybin, because we're activating all those serotonin receptors. Ketamine bypasses that. Glutamate's in the brain. The only reason we would feel nausea usually is more related to just feeling off, feeling anxious, or if we don't have a really healthy liver. If maybe we had a binge drinking episode a few days ago and our liver's a little backed up, then it could create nausea. But that's a different mechanism than psilocybin. So I would say it's probably more protective, but still possible.
Okay. Well, you mentioned it earlier as well on the K-hole thing. Obviously, we know all these tech billionaires are all hooked on ketamine. How are they using ketamine that's different than the way that you're using ketamine? And is ketamine an addictive substance that somebody needs to worry about? Because I know that most psychedelics are not addictive. So what is it, in your opinion, like what is the difference in the use, and what is it that's making it so addictive for that particular group of people and not for the individuals that are going through the therapy?
Yeah. I think some people are using, many drugs and ketamine included as a performance enhancement. And when we do that, we start to think about performance enhancement tools. Historically, you take it when you need it, right? And if someone is really in a high performance field, they're developing a tech company or something, let's say, maybe they think they need to take it every day to perform. This is not the way that I see ketamine being used. Instead, it's back into that psilocybin therapy, psychedelic therapy type model where it should be done once weekly. There's some companies out there, and I don't want to speak badly about any other clinicians, but I don't think the safety supports what some companies prescribe as daily use of ketamine. And I work with a lot of medical boards to understand, well, what is safe practice and what is unsafe, and how do we really understand that threshold? And so for me, it's if you're doing this once a week, as it should be done, we have years and years of safety. But if you're doing it every day, well, one, you develop a tolerance, and so you're looking to increase the dose to achieve the same benefit. Two, there is a little bit of a dependence. There's a craving. There's a feeling of without it, I'm not who I felt I should be. And that's the psychological habit as well as the chemical. Now, with the protocols, once weekly, you avoid all of that. So if you can stay true to what your clinician is prescribing, which is most of the companies out there are doing once weekly protocols, then you avoid dependence, you avoid tolerance, and you avoid addiction risk. I think it's important to look at this as a time to check in and not a time to check out. And yes, some people do abuse ketamine for the escapism functionality of it. But I think what ends up happening more often than not is if we go in with the right frame of mind and intention, the ketamine isn't calling us to do it again the next day. It's actually allowing us to feel refreshed. The overwhelm goes away and we can just kind of practice our normal habits with so much less clutter. And it's not as if we need to chase that rabbit, So I've been in this work 6-7 years, and I've had few cases where patients said, they ran out, they overdid it, and they volunteered that information because they were worried. For the most part, though, we prescribe only 4 doses a month, maybe 8 doses a month if we're starting with twice weekly. And so you don't really have the opportunity to overdo it. And it's not something I've noticed is, leading to bad habits. It's mostly actually, I think, treating addictive habits, because that's what lives in our default mode network, the back of our brain that says, I feel stressed out. I don't like what I'm experiencing emotionally. I need to change this. That loop becomes, detangled, and all of a sudden you could start from scratch. So we're actually seeing it as a good tool for addiction recovery for those who have been sober for at least a week or two.
Okay. Okay, that's really interesting. Yeah, I like that it you can build a tolerance to it. Psilocybin's the same way. That's why, the Stamets protocol recommends 4 days on, 3 days off so that you don't get that. And don't hopefully there's not too many people out there signing up for heroic doses every other day. But I definitely understand the need for a break. I want to envision this, if you don't mind. Do you mind if we walk through a scenario where somebody comes off the street and they're approaching your clinic and they're making that initial introduction? I want to see a psychiatrist. I'm suffering from suicidal ideation. I'm a veteran. What's the first steps?
Yeah. So first, we'll schedule a video visit. If we have a local office and somebody prefers to come in, we can see them in office. Some states actually require that. So it is a state by state regulation. There's only about 5 or 6 that require in-office visits. For the most part, you can just meet like this, virtually from your computer or your phone. And what we'll do is first a medical review. And I think most people are honest about their health, but if we're unsure, we want to get medical records, verify good health. We always make sure that somebody has a blood pressure monitor at home, because that's the one rule out is if your blood pressure is high, you shouldn't be doing this treatment. So we check all of that medical history, make sure there's no history of seizures, no uncontrolled hypertension or cardiovascular issues, make sure that liver's healthy. And then we do a psychiatric review, because while starting on a very small dose, 9 out of 10 times doesn't create any kind of a bad trip. Those repressed feelings that sometimes come up, those hidden traumas that have been pushed away for years or decades, if they come up and we feel unstable in our mental health, our social health, we don't know how to address that, then that might lead to a bad outcome. So we want to make sure that there is at least some psychiatric stability. We're not having psychosis. We're not having mania. If we are going through severe anxiety or severe depression, even suicidality, that there's somebody with us. The social support is the other part that we gauge. Do you have someone in the home who can keep an eye on you when you're doing this? Now, some people say, I don't even want to do this at home. I don't feel safe in my home. And so we invite them to start in the clinic and then maybe graduate to doing their maintenance treatments at home. But those are the things that we really look for: medical health, psychiatric health, and social support, to make sure that we have the right container and the appropriate candidate, that we're not causing harm, and we can process what may come up. Session 1 is usually very gentle, relaxing, but by session 2 or 3, we're doing a little bit of the deeper work.
Okay, interesting. Yeah, I love that. Is probably my favorite part of the professional clinical side of psychedelics, is the care and the ensuring that you're dealing with healthy individuals. I've been hearing a lot of pushback lately with psychedelics. You're going to get bad press no matter what you do, and there's starting to become this narrative that psychedelic experiences produce psychosis. What is your opinion on that, and what is the validity, and do you know anything about this before I ask you some specifics?
Yeah, I think it's an important topic, because the short answer is, to the question, can psychedelics induce psychosis? The short answer is yes, it can. But the reason that we see this and we're concerned about it isn't through clinical usage. It's not to someone who came in with good intention and good support. It's the person who was dehydrated already. Maybe they were drinking already. Maybe they mixed substances. Maybe the substance they took was dirty. And now the brain is really fragile. It's not in a healthy state to experience this kind of neuroplastic reset, and that can cause damage. I've had patients who, had a history of possible mania, possible psychosis. We weren't sure, but we go back and we understand, okay, this might have been sleep deprivation. Maybe this was drugs. Maybe this was trauma induced. And right now we haven't experienced that. And I've never had anybody who all of a sudden said, oh, psychosis came back out of the blue, poof, just because I did this treatment. Now, if somebody abuses LSD, if, again, they are on a cocktail of different drugs at the same time, yeah, I mean, frying the brain is, like, as cliche as that sounds, it can happen with too much drugs and a poor medical health. But it's not the common experience. So I don't think people should be scared that all of a sudden they're just going to become psychotic out of the blue after their experience. In fact, they should feel much more relaxed, much less chaos in their mind. And so I think it's a little bit of a misnomer to say that psychedelics induce psychosis. They can. If somebody has a history of schizophrenia, we need to be very careful. We don't want to activate those genes. But for the most part, when clinically done, I think we're in a good place.
Okay. Okay, good. I'm glad that you answered it that way because I actually had a guest turn me down. I don't know if she's going to change her mind, but I invited Dr. Jill Bolte Taylor on the podcast because I love her book, Whole Brain Living. And I learned so much about neuroanatomy, and that kind of started me down that path of like understanding myself, not just from the medical, spiritual side of things, but understanding also what is happening physiologically inside of my body when I'm taking these medicines, and how can I better work with those medicines. And she denied an appearance on the show because she said that it was her belief that it creates psychosis. And I thought, well, that is so odd because I don't know anybody that's done psychedelics that has ever ended up with a psychosis moment. I've heard about that with 5-MeO, people that are launching off to the stratosphere without any preparation or any prior work going into that. And I thought, okay, well, I could see how that could be very disorienting if you've not been in that space. And I don't know, I don't even know if you're allowed to say, have you done psychedelics yourself other
Yeah.
in your
I
personal
speak
life?
openly. Yeah, I speak openly about this. I mean, I follow all the legal regulations, and I'm a patient of this work. I do ketamine therapy once every 1 or 2 weeks, sometimes every month. But for me, it really helps me to find my alignment, prioritize what's important, realize what wasn't important that captured my attention and took, mental equity, and reset all of that away. So for me, it's been a game changer over the last 5-6 years now. Dabbling in other psychedelics, I don't have a lot of experience, but in legal regions, I've had, been the patient and had people hold ceremony for me. So I think it's important to not create this chasm between the practitioner and the patient. We're all patients in this work. Mental health touches 100% of us. And it's not something that we need to, I think, alienate each other and say, like, I'm the professional and you're the one who's the patient. You need to listen to me. Like, no, I'm learning just as much as anybody else. So I think it's important to acknowledge that as doctors. We need to practice what we preach.
Wow. Yeah, I wish I had buttons. I need a standing ovation button right now. And this is why you're on this show, sir. That is a perspective that I wish more people would share. Even in this space, I'm a facilitator myself, not in the same way that you are, but there is definitely this narrative sometimes that gets pushed that the healers don't need healing or whatever the case may be. And it's like, no, I do the work on myself as much as humanly possible before I even think about trying to work with another human being. That you're right in the fact that this human experience is challenging. I don't care who you are. And, you're not going to just get through this thing without any wounds as you go through. Like, life is challenging and it comes with a certain level of trauma. But this work kind of helps us mitigate that and kind of work through it. So I applaud you, sir, and I commend you for doing the work yourself. I know a lot of clinicians in this space that won't touch the medicine. I know a lot of researchers in this space that won't touch the medicine. And that has really shocked me. You've dedicated your life to something that you have no physical experience with whatsoever. And so, yeah, thank you.
I think thank you for the acknowledgement. I think it speaks to looking at the arsenal of psychopharmaceuticals that we have and seeing the shift. If I had a loved one or myself, if I was feeling very deeply depressed, like I probably wouldn't run to an SSRI. And with my patients, I'm very honest about that. The data justifies the fact that SSRIs are probably going to, more often than not, cause more harm than good. If you're lucky and you're one of the small proportion of people that it works well for, it may be life-saving. And I don't want to overlook that. But for the majority, it's been harming people and not helping them. And so I wouldn't run to Prozac if I was having a hard time. That speaks to the shift in the medical model, is that now there's medicine out there that I don't think is creating as much damage as we've seen before. And because of that, it feels safer to partake and to gain benefit from. So I hope that we start to see more experiential medicine rather than just passive meds where it's like, take this pill every day and maybe things will get better. That scares me a little bit. What's actually happening? The scientists don't know 100%. And so my patient who's trying to learn from me and I'm trying to educate the best I can, I have to be honest about the limitations of what we don't know. We also don't know a lot about ketamine, but it's been around for 50 years, and the safety studies are, 6-7 years now in clinical trials to do it once weekly. And so it really just, for safety reasons and for the fact that it doesn't target, in my opinion, one disorder. And I don't even like to think about mental health disorders in that language. I think we should talk about mental wellness, not mental illness. We're talking about brain health optimization. And that's for everybody. That's not for someone who's depressed or someone who's anxious. I think everybody can benefit. But of course, we have to play by the rules and, practice within the DSM criteria and everything. I hope one day we move away from that.
Yeah. Yeah. I love that you said that. I have been one that is been turned off by SSRIs, and thankfully I've never taken anything like that. I'd heard such bad experiences from people that the one thing that I knew I didn't want, even when I didn't know anything, was I did not want to be on that medication. And what I like so much about the psychedelics is, outside of the use of psychedelics, the work is on the individual, and you're doing the work in your day-to-day life. I don't need psychedelic medicines to function as a human being. I use psychedelic medicines for moments of awareness. I use it for, like you said, the neuroplastic benefits of healing my brain. I had a lot of TBI. I was a combat engineer. I got blown up a lot. Then I decided to let people punch me in the head for 16 years. And I started to notice that my cognitive abilities, I was starting to slip. My memory wasn't quite as good. I would slur a little bit when I talked. And when I understood what psychedelics do for the brain, the neurotrophy and the neuroplasticity elements of the medicine, it was like, oh, I'm not, my brain isn't healthy. If we had broken arms or broken legs, somebody would see that something is wrong, but you can't see inside your brain, and you don't know that you have damage up there. Now, I know that people like me have that, but what else causes that traumatic brain injury? And what do you see in your clients in their experience outside of the military or outside of people that have decided to be a lifelong fighter?
I think the biggest impact on, having mental health conditions, having symptoms show up, it's really just the brain not being aligned. We have all these scattered thoughts, and it might be a trauma response. It might be an insecurity. It might be abuse. It might be neglect. It might be bad habits, unhealthy habits, toxins we put in our body. All these separate things are happening. And we want to then create a narrative that, I'm okay, everything's okay. But no, there's a lot of things that need attention. And whether it was direct head trauma or emotional trauma that was stored in the brain, the computer system is affected. And we have to understand that and appreciate that all of our brains have had some kind of trauma. Now, how do we respond to that? What is the health and structure like once we've gone through that? One of the things we're really excited about with Anywhere Clinic is launching an acute trauma program to say, don't come to us. I mean, come to us later also, but don't wait to come to us. If something happened that is shocking your world, the best time to treat that is when it's happening, because that trauma will be stored in the nervous system, in the brain, in patterns, and then it becomes harder to unwind. Certainly not impossible, but harder. And so if we can intervene early when things happen, and this is where it's really interesting. You look at child psychological development, and for us as adults, we think of trauma with a capital T. Something really has to have rocked our world. But for a 3-year-old, trauma is very different. Trauma is not getting attention. Trauma is the ice cream falling on the ground. Trauma is not getting affection when we are feeling fearful. And what happens in that young brain then extrapolates over time. And so what I love about the medicines that we're working on now is we're really resetting things. The question that comes often is, how long do I have to be on this medicine? If it's working for me, can I come off? And the answer to that question usually relates to, how long have you been suffering? How long has the brain been running patterns that aren't serving you? And the longer it's been running, the more time we need to unwind that and work on that. I've had people who have acute trauma, and all of a sudden, one treatment, they're back. Things were reset. Their baseline was so strong previously that we were just able to hit Control-Alt-Delete and get back to that. And so This is for all diagnoses that I think in psychiatry we overdiagnose, we slap on labels way too liberally. I think the one that we underdiagnose is PTSD. We all have a level of trauma in the brain.
Mm-hmm.
Unfortunately, we can't image it. It costs $6,000, $7,000, $8,000 to get a functional MRI, and it doesn't even tell you that much right now. And so our profession is part science, part Shakespeare. We got to talk to you and figure it out and understand what that programming is.
Yeah, that was very well said. I think I would like you to provide me a better explanation. You said that trauma is stored in the body. This is something that I hear people talk about all the time. And I have researched the impact of stress on the body and the neurodegradation that occurs during high levels of stress or long periods of stress. How is the trauma stored in the body, or did I just kind of touch on it with the degradation of brain tissue and things of that nature, or is it more complex than that?
I think we can look at it very simply in a computer analogy. You have the hardware and you have the software, right? The hardware are the neural connections, the nervous system. When we have that fight or flight reaction, it's happening throughout our entire nervous system. We're getting cortisol, we're getting adrenaline. Our nerves are sharp and alert and tense. And so that's all hardware. But when trauma happens, not only is the hardware impacted, like literally TBIs, you have direct trauma, and so the hardware is impacted that way, or a lived experience can actually create chemical and neural patterns that hurt us in the hardware. In addition to that, there's the software that was damaged. The reason that two people can go through the same trauma and come out differently is because of the meaning that we make. While the body keeps the score, meaning writes the next chapter. And it's, what are we describing to ourselves that just happened? And this is where you look at any trauma and you think there's a resilience trait sometimes when people go through their trauma and say, one, I accept it. I'm not hiding from it. I'm not repressing it. Maybe it's terrible. Maybe it's tragic, but I'm facing it. This happened. Then what's the meaning I create from that? Is it, I don't deserve love. I deserve to be punished. The world is a terrible place. Or is it, adversity creates strength? These things are teaching me, these experiences are teaching me something that maybe I don't even understand yet, but I know it's going to make me stronger. And I'm listening to the universe to guide me through the dark times. That's a different meaning than, I can't believe this happened to me again. I don't think I'm ever going to outlive this cycle. So we have to work on both the hardware and the software, and they get equally impacted by trauma. And this is where talk therapy and things like that help with the software. But I always say you can't run new software on an old computer. And so if the brain is just rigid and has been running these patterns that aren't serving us, and literally we have chemical and neuronal patterns that hurt us, well, we need to clean that up before we try to even go to therapy, before we even try to install the new software update, right? We got to update the hardware first. So I think thinking about it in that perspective, you start to see that trauma has two components and they both need attention.
Yeah, I agree with that. That's very similar to something, and you said it a lot more eloquently with a lot more science and understanding than I've ever given it. But I've talked to people about that. I said, even my longest period of trauma in my life was 7.5 months. But what I discovered after the fact was that for the next 16 years, I traumatized myself. It was my perspective, my beliefs, the internal narratives that I had adopted, the things that I was saying to myself, that I kept re-traumatizing myself over and over and over again. And it is like I found when I started my healing journey that I felt like I went through the initial event trauma pretty quickly, but that remainder really is what took the most time for me personally to figure out. It's like, oh, how do I heal the last 16 years that I've just been beating the crap out of myself and had no idea that I was running these narratives or these programs, so to speak. And and hopefully I tied that in okay. You can correct me if I'm wrong, but
I would ask you, when you said you were traumatizing yourself after the fact, this is the normal trauma response, right? We run those patterns, we're hypervigilant, the uncertainty, the what ifs, and we just run all the playbook on constant repeat. But what if the hardware was tended to at that time? A lot of people say, oh, go to therapy, talk it through. But what if for you were able to actually calm down your nervous system, reset the brain, and then would you have traumatized yourself afterwards? That's part of the magic without therapy. And so that's really where we look at trying to improve the hardware with psychedelic medicine, neuroplastic therapies, plus then now let's not re-traumatize ourselves, right? Let's create new programming. Does that speak to you? Do you think if you had that opportunity during the acute stages of your trauma to reset the hardware, it probably would have been easier?
1,000%. I mean, my experience, obviously, I'm here today because I'm a huge advocate for plant medicine. It changed my life. And also, just so that my audience knows, with my plant medicine usage has come a lot of psychology and going and getting therapy. I've done a lot of cognitive behavioral therapy. I've done a lot of talk therapy. I have read all of the books and I've done all of the work. Like, it wasn't like just the medicine itself did that. But when I first got to the medicine, one of the things that I learned, there's a lot of these medicines have been around for thousands and thousands of years. And ancient tribes used to use this for their warriors. When they would go off to war, when they would come back home, they would sit with the medicine. And that sounds very similar to like what you're promoting right now. And I thought, when I heard that, I thought, man, I really wish that would have been there for me. Like, this would have been life-changing in that moment, but also realizing that those indigenous cultures start like at 4 years old or something like that. They're literally putting ayahuasca on their fingers and rubbing it on the gums like we do, like whiskey, and these children are getting some of these experiences. But yeah, I agree with you. I think being able to have access to that therapy and access to that help closer to the trauma would have dramatically changed my life, because not only did I spend 16 years traumatizing myself, I spent the better part of 16 years developing terrible habits, terrible patterns, inflicting irreparable damage on my family, my friends, people that I didn't even know, my coworkers. Like, there was so much carnage left on that path that, yeah, if I could have fixed that at the beginning, that would have been life-changing. And not just life-changing for me, but life-changing for a countless number of people that have had the opportunity to know me in my life.
Yeah, well, and also because this happened the way it did, it made you stronger. And I've gotten to know you just briefly so far, but I can sense the depth through your experiences, through the resilience. I'm sure you were someone who had to go back because of your moral fortitude and clean up some of those relationships and undo some of that damage. And that made you stronger. And so I think, it's a testament to all of us learning to love our story and the entirety of it, even the dark parts.
Yeah, that has been the hardest thing for me. And, we all have these different elements of growth and things that, you hear along the way, these idioms or whatever. But the hardest part for me was really coming to terms. I'm somebody that's suffered with almost like existential level regret. It's like I would look back at every mistake, everything I ever did wrong in my life, and then I would just beat myself up relentlessly over it, or I would wish that these things didn't happen. And I was one of those guys that would say, if I could go back and do this over again, this is what I would do. And where I've changed that recently in my life is I no longer want that, because I realize that I am very happy with who I am today. I'm so happy to be the human being that I am today, and I can't be that person without that. And so it's almost like I've adopted it as like this necessary challenge that occurred in my life so that I could get the learnings that I needed to move forward on the path that I'm on. And I that has been one of the most difficult things for me, is learning to be able to say goodbye to that regret side. Is that a common thing? Am I the only one that dealt with that, or do you see a lot of
Absolutely
patients
not.
struggling?
Yeah. I think shame, blame, and self-judgment really, sucks the energy out of us. And so the hardest thing for me is to help patients who grew up with a warrior mentality, who grew up with a very macho upbringing, to start to talk about the concept of self-love. It's so challenging because I get this response that's just so unfamiliar. It's not that the person doesn't want to love themselves. It's just like, that just sounds terrible. Like, to even think about those terms, like, I don't deserve that, or I don't even know what that is, or that just sounds, like something for me, right? And when you can start with self-love, it's almost like if you have a child and you're guiding the child, you're not judging or shaming or blaming. You're teaching, you're guiding, you're empathetic, you're loving, you're compassionate. We have to be that way with ourselves. And I think that's one of the big transitions that we gain from psychedelic medicine. I don't see somebody on Prozac a month or two later say, I'm kinder to myself now. But I do see that with psychedelic medicines.
Yeah. Oh man, I have a lot. I have so many questions that are getting ready to come at you, but I love the self-love topic. It's great when things happen in podcasts that are very relevant to my life and like the now. And I just had this fantastic conversation with this dear, close, personal friend of mine who is actually struggling with this right now. Like he's on this healing journey, he's on this emotional like remembrance journey, and I asked him, I said, what is your goal in all of this? Like, why are you doing this to yourself? Like, what exactly, why are you reliving all of these traumas and trying to process things? He's, well, I'm trying to get to a place of where I want to love myself. And I said, well, you don't love yourself? And he says, I want to, but I can't. Now, that's all the information I'm going to give you. I'm very curious. How would you answer that question for someone that's saying that to you? What would your advice be?
Yeah. Well, it would depend on the person and what their day-to-day is like, their social support, their spiritual outlooks. I want to understand what makes them feel their best self, because when they can feel that, it's easy to practice self-love. It's this rejection of self that has been created through traumatic patterns, through abusive patterns, through perceived failures. And so we just start with, tell me something that you are proud of yourself about. Tell me something you do connect on as far as self-praise goes. And that can become quite challenging. The other part is, I think self-care and self-love are very, very closely connected. And while self-love might sound like a big monster to some people, caring for yourself isn't as bad. And so I want to know, how do you care for yourself? Because we do acts of kindness for ourselves that sometimes we probably don't notice. One side are character traits, personality traits, morals, values of yourself that you can align with. And let's breathe life into that, because there are some things that exist there, even if we're in the most pessimistic mindset. And then on the other side of that, what are the times in our life where we do feel this sense of comfort, peace, and love? And let's lean into those kind of activities. And often it brings me back to, someone shares a story about their grandmother, grandfather, their distant relative, a time when they did feel that love. And then I want to unwind, what happened to where we felt like the world was a scary place, where we felt like we couldn't trust ourselves, where we felt like we couldn't create that bond with self. And, it takes a lot of work. If we dive into more of a metaphysical treatment, we'll do some body exercises, and we'll start to do some visualizations that are heart-centered. I'll ask someone to start a breathwork meditation with me while they're checking their own pulse and feeling the blood flow in their body, feeling the miracle of their heartbeat. And sometimes when we get out of our mind, it's easier to just connect with self when we're in our body. This is the biggest challenge in my work. So your question put me on the hot seat. And, this is a lifelong study for me to figure out how to help people enhance self-love.
Well, I think that was a pretty exceptional answer. And it definitely showed me the veteran hard ass in myself that I was like, oh, yeah, I could probably be a little softer with how I address that one. So, but that's what I love about having conversations with individuals like yourself and other bright minds and people that have done the work, is nobody has the one answer to fix everything. Everybody needs to hear a message in a certain way and a certain thing. I'm a pretty stubborn person naturally. And so I respond best to getting smacked in the side of the head. Like that really is, I get so tunnel visioned and focused that like the only way to get my attention sometimes is you just got to backhand me, or I'm just going to like train forward and blinders are on and like, here I go. And, but I also realize that not everybody needs that kind of approach, and I've had to learn over the years to be a lot softer and a lot less direct and a lot more understanding and empathetic. And I think what individuals like yourself bring to the table with your vast level of experience working with so many different people is you just have such a broad understanding of the human psyche and the human condition and what it means to be a human being, that you come at this from an angle that people can relate to. Like when you were speaking, I related to that. I was like, oh, you're right. Self-care. I'm so glad that you mentioned that. That's something I had to learn. I just started doing self-care a couple of years ago, and it was completely foreign to me. And you know, we have all these stigmas in society, and I was always such a ego-driven masculine male. It's like, you know, I'm not going to mask my face, or I'm not going to do this. It's like, you know, trimming my fingernails is somehow like girly. And now I've really embraced that, you know, I'll take baths, I'll do Epsom salt baths, and I'll put masks on my face, and I work on my face, and I heal because you're right. That is part of loving yourself. Why would you do that for someone else if you're not willing to do that for yourself? Taking care of this vessel and this being, like, to me, health is everything. Health is so important. And I feel so bad for people who have chronic illness or chronic pain, because it's hard for me, somebody who's not had that, to imagine how challenging that must be to move through life with when you don't have health. I mean, do you see a lot of these people in your practice, and how do you help them?
Yeah, I think one of the biggest topics that we're actually starting a group on is the topic of aging, injury, illness, and death. And inevitably, we're going to catch up and have to deal with all of these things in our lifetime. And so whether it's chronic pain, injury, chronic illness, I think it's part of the bigger piece here. We don't, as a Western society, look at these things. We don't talk about them. We don't talk about death. We go to a funeral, we cry our eyes out, and then we leave, and we never talk about it again. You know, it's not part of our daily routine. And when we repress these things and push them aside, I think we lose a little bit of the value of understanding life as it is. And we want everything to be shiny and bright when the world is full of darkness and shadow. And so shadow work is a big part of this, and I'm sure you're familiar with that as a broad concept.
Absolutely.
But it's, you know, just really accepting those things that are hard to love about ourselves. That's the shadow work we do with ourselves. It's accepting the things in the world as they are and not resisting it. You know, you may want to change it. You may want to work towards a cause, but if we resist it, well, that will just drive us crazy. And so this speaks really to my early career in psychiatry. I was very resistant. I said, like, this is terrible what we're doing to people. I almost got kicked out of residency a few times. You know, I was really challenging the status quo. But then I kind of shifted in my approach, and it might have even been psychedelic therapy that helped me to move from resistance and animosity against the system, and instead adopt the Bruce Lee mentality: be water, flow with it. You know, yes, Big Pharma probably didn't do great things for the majority of what was happening, but when they brought S-ketamine to market, that was a game changer. That allowed clinicians nationally to say, we can use ketamine now as a psychedelic therapy tool. And so now we're swimming with the current, recognizing that there are some impurities and things that we need to detoxify. But accepting that dark part rather than resisting it, I think, is a big part of the journey.
Absolutely. Yeah. And I can tell, like, just from speaking to you, I can see and feel the influence of the medicine in your demeanor, because you are, at least to me, these are the words that I use for things. You're speaking about a wholeness of self, mind, body, spirit, addressing everything as one, where I felt like early when I went to a psychiatrist after I started to recognize that I had PTSD, 15 years later, and I decided, well, maybe I should try to talk to somebody. But that talk therapy just didn't land for me. And there was a a psychoanalyzing that was happening that wasn't helping me in my day-to-day life. Like, it wasn't helping me change my thoughts. And in fact, in a lot of ways, like retelling the same stories over and over and over again, because I was living those stories. Now I can talk about these things much differently. I've kind of found a way to disconnect where I could tell you the story, but I don't have to be there. But anytime that I'm present in a story, I'm almost in a way like re-traumatizing myself. I'm feeling and experiencing everything that I had in that moment. And that was exhausting. That was exhausting. And it was like, I just didn't see how this was helping people. I went from like wanting to kill myself to like, somebody please kill me. Like, I wasn't enjoying the experience whatsoever. And I finally quit that version of therapy because, it was just like, well, if this is what I got to do to go through, it's like, I felt like I was getting worse and worse and worse with almost every session. Is this a common theme? Is this something you hear people talk about as well?
I'm glad you brought it up because very commonly we have people who say, I've done it all. I've tried the meds. I've tried talk therapy for years and years, and it doesn't feel like I'm getting better. I led a retreat in Puerto Rico. We have a retreat center in the jungle on the river. We bring people out for 3-4 days, and it's just this beautiful respite with all the tropical sounds of the jungle. And we do a river plunge, and we do the ketamine work, and it's all legal. And we did a veteran retreat. And I recall, to your point, we were doing a group, and there was a lot of talking and, the cognitive part of therapy, right? We're all in our minds, and then our minds create these emotional reactions. And I had somebody who I was working with had a very angry reaction, and he couldn't control himself. He was ready to leave. It's like, I'm getting my bags, I'm calling an Uber. And I said, we're kind of remote out here in the jungle. Like, there's no Uber, so we're going to have to figure this out. So we started walking, and I already had gained his trust. I knew that he, felt comfortable with me, but I said to him, and it's the first time in my life that I tried something. I said, can I hold your hands right now? And out of all the anger and frustration, we just started holding hands, and I just sat with him, and I slowed down my breath. And what I was really trying to do was co-regulate, calm his nervous system, calm his breath down without even saying a word. Literally for a minute or two, we just stood there holding hands. And I saw the anger melt away. I felt it, and that was not taught to me in medical school. That was not taught to me in a psychiatry book. But I think we have to, as a society, get out of our minds and get more into our bodies. We have to turn off this brain that's driving us crazy and just be in nature, be with someone else, be present. It was literally just 2 minutes of that when all of a sudden a distant neighbor came by and offered us some mangoes, and this gentleman spoke Spanish, and it was just, he had this really nice conversation. But it required a whole shift in body. And it wasn't even a shift in mind. No words were really said. But it was just, let's transform this energy. And I think that's not what we're talking about in medicine. It's like, well, what pill should we have given this person? If this is a hospital, we would have just jacked him up with a B52, Benadryl, Haldol, and Ativan, Instead, he just needed someone to just help him feel safe and ground him. And, worked out. Lucky for me, I wanted to make sure he was okay, and he ended up staying the whole retreat. But that's an example of where medicine falls short. I think, we're encouraged. I was told, don't touch your patients, right? There's transference issues. You're a psychiatrist. You don't need to put hands on anybody. And then all of a sudden I run a ketamine clinic, and everybody comes out the room and says, Doc, can I have a hug? And I'm like, of course, love is medicine, and we need to bring that back.
Oh, man. Wow. It's not too often I'm speechless, but here we are. So, you just said a bunch of stuff I've never heard a psychiatrist ever utter out of their mouth. So now you've really intrigued my curiosity. You can talk about this if you want to. If you don't want to, I'll edit this part out. What happened to you that brought you to this space where you were at? You legitimately care. You love people, like actually. You're not just doing a job. Why are you doing what you do? What's your why?
Yeah, thanks for asking. And I think it's a ever-evolving why, but from a young age, I always say I was born into a family of love. I had 2 parents who were very loving to me. I had 2 older sisters who were like 3rd and 4th parents to me. I didn't have any trauma really that rocked me. All the trauma growing up was self-induced, teenagers getting in trouble, young adults having a problem with authority and getting in trouble with the law and all these different things. But I was given so much love growing up. And every time I made a mistake in life, I saw the universe just kind of like showing me the guardrails, showing me the bumpers and saying like, don't venture too far off. You will fall off. And I just listened. I don't share this too publicly, but 18 years old, I just turned 18 and I kind of didn't have a good moral compass at a young age. I was full of love. I was a good kid. I was a smart kid, but I don't know. I had kind of influences that told me it's okay to do bad things sometimes. And I got in trouble with the law. And it was in that moment where I literally just had almost just like a breakdown where I said, I need to open my heart more to understand, like, what am I doing wrong? Why is this okay? Why did I just do something that hurt somebody? And now I got in trouble. And I didn't even think about hurting somebody. That empathy gene wasn't really strong for me. But I had such a foundation of love. So as I went through my own adversities and understood why I was making these mistakes, I think I felt a responsibility because I was given so many chances and I was given so much love and guidance that I just feel like it's now my gift, my calling to give back to the world in a way where, I still have challenges. I'm not always my best self, but I take the most complicated patients. I take the ones who are their provider because they're getting in fights. I'm the owner of the practice, but I have patients who threaten to sue us and I'll still care for them. And that helps me to grow through some of the anger and reactivity and really embrace the love that was given to me and that I feel responsible to give back to the world. So that's really the short of it. I fell into psychiatry kind of by accident. I didn't want to go to med school. My dad pressured me and I found Las Vegas had a medical school. And in my early 20s, that sounded fun. And then I fell into psychiatry and I really realized that this is the one field where we can make the biggest change. Cardiologists are saving lives, emergency docs are saving lives, but if we can really restore mental health, emotional health, spiritual health, we're saving communities. And that spoke to me. And so I'm really just trying to scale out my calling as much as I can.
Oh, I love that. We always hear the horror stories of what happens when you have a rough or a hard childhood and how that develops you into a person. Maybe one of the few stories I've ever heard about somebody who's had a positive childhood and what it has developed them into as a person. And that may be the most inspirational thing I've ever heard because it's proof in the message. That is what that's what I'm doing this for. I very unapologetically really do want to change the world. And I know I'm just one person and it's impossible to change the world alone, but I don't care. I'm stubborn and I want to. I want to help as many people as I can possibly help. But one of the things that I realized a while back, and where I live is actually evident of that. There's a huge psychedelic community in this space where even if you don't do psychedelics anymore, at some point in your life, you probably did. And what it has done is it's built a community where people still have community. Yeah, not everybody agrees. There's right and left and Republican and liberal and all this other stuff that still exists here, but everybody's still nice to one another. Everybody still cares for one another. There's charity, there's empathy, there's kindness, and it's just inundated into the culture. And that is what has really fired me up and inspired me to say, man, this is how we're going to change the world. We're going to change the world by healing the individual so that the individual then proceeds in love and kindness toward others. And your story is even more profound where it's like, oh, sounds like your parents already had that and they instilled that into you. And then you grew up and then you brought that into the larger community of the world. And that is such an uplifting message for myself. And because it's like, oh yeah, we're not wrong here. Like the potential of this to spread like wildfire is immense. And I'm just so grateful that there are doctors out there like yourself that are approaching things this way. Like you said, even with the hands-on, with the breath work, you talked about the I forgot what word you use now, but healing through your own energy, right? Your own calmness and
co-regulation.
Co-regulation, yeah. And that is something that a lot of people don't know, the listeners do, but a lot of people that don't know me is I used to be a preacher. And so I was an Assemblies of God ordained minister, and the laying on hands was really I didn't understand that, right? And then the whole time that, because I had come from like the Southern Baptist background, and like I'd always witnessed the laying of hands. You got the prayer circle going on, and there's all this stuff happening. But it wasn't until much later down the road when I got into psychedelics that I had theorized what I felt was happening, where that co-regulation was occurring, right? You were bringing calm, you were sharing that energy, you're putting those thoughts and those intentions into that other person. And that's kind of how I had kind of formulated that. But there was always this little part of me that felt like, it's a little woo-woo, buddy. You're not 100%, but then somebody like yourself says co-regulation, and I thought, oh, then it clicked. It's like, okay, there's something more to that there. What is there a science behind that, or do you also subscribe to it as just energy and emotional connection?
Yeah, well, we live in psychiatry on the border of science and spirituality. And I think the gift that I have in my work is to be able to work with so many people across so many cultures and different states. I'm licensed in 30 states, and, just different demographics and different communities, all seeing very similar human experiences, but putting in those reps, without a scientific model to measure, you kind of get that exposure, and you can start to realize, wow, when I'm actually feeling more compassionate and loving, I notice my patient walks out of our session feeling better. When I'm frustrated and upset, like, didn't really help the other person on the other side, even though I hit it, but it was something that I was sensing. And it's just these lived experiences. There's, we talk about how do people, become the best of their industry. And there's one story that always stood out to me. It was a pro athlete, Jerry Rice. Do you know his story? I can tell it real quick.
I do not. I would love to hear it.
His father was a bricklayer. Jerry Rice, as we know, is probably unarguably the greatest wide receiver of all time. When he was young, he would go to work with his dad every day. And his dad would say, hey, Jerry, get up on that ladder. I'm going to throw you a brick and you put it on the wall. Imagine, as a child, growing up every day, standing on a ladder, trying to find your balance, catching a heavy brick. And so he was catching bricks every single day, and lo and behold, he became the greatest wide receiver of all time. I think the blessing that I have is I get to practice empathy every day. I get to practice love. I get to practice compassion. When I see the most challenging cases and people are directing their anger at me, I get to practice still loving them through that. And that's just who I am as a professional and what I do for my job. But those are the bricks that I'm laying every day. And so that, I think, more so than anything that may have happened in my childhood, it's just the repetition through my adult life of, being blessed to be able to serve and help people every day, and seeing the impact and seeing how that makes me better too. So I feel blessed in that regard.
Wow. Well, man, I am so glad we took the time to have this conversation today. And I'm definitely not done having conversations with you, because you're a fascinating human that I would love to get to know more. And we'll definitely talk offline. I'm very interested in getting some services from you. I think this retreat that you talked about in Puerto Rico sounded very interesting to me. And I want to explore a little bit more about this ketamine meditation. And I always have more to learn. And so I'm very interested in what you do, and we can talk about that. But we're going to go ahead and wrap the show up, and so that we can set the stage for future shows that come along. I want to extend an invitation to you. Anytime that you feel like you would like to come on this show, you let me know. You have an open invitation. And do you ever have any clients or situations that are occurring that you feel is like, really need to talk about this, people need to hear this, then that's when I want you to contact me. So for anybody out there that is listening that would like to get in contact with you, you said you're licensed in multiple states. Could you go ahead and just give people a way to get a hold of you? What states are you able to help people in? And what information would you like them to know if they would like to start therapy today?
Absolutely. So we are actually licensed in almost every state in the country. There's only a handful, and we're almost capturing all that. It's anywhereclinic.com, where you can sign up for virtual care, and we do accept insurance in most states. So whatever your health insurance is, we'll see you hopefully through that. If we're not in network, it's only $150 a visit. And all this work can be done virtually. We also have in-office clinics in certain regions. And I think really the message is, whether it's a professional, a mental health professional, a psychiatrist, a therapist, or it's a loved one, or it's a colleague, or it's a stranger, I think we all need support. And not only should we look at our journey as not something that we should be isolated and alone in, but those who give us support can also be supported. And I think the biggest thing is, the more we give, the more it fills our cup. And so for anybody who's feeling like their cup is just empty, lean on somebody for support. And if you want to find that, perpetual filled cup, then continue to give that gift to others as well. And I see you doing that. I appreciate the example that you set for the community. And it's been a pleasure chatting with you.
Well, thank you very much. I appreciate your kind words. That means a lot. And I love the work that you're doing. And I'm looking forward to getting to know you more. I'm looking forward to getting to work with you myself. I think I have a lot of learning and growth that I can get in this space still. Like you said, we're never done, right? This goes on. Every day I'm looking to be a little bit better than I was yesterday, and that is going to continue until I'm not here to have another day. And so I'm always trying to be open to receive whatever gifts, whatever wisdom and knowledge can come my way. And so I'm definitely looking forward to that. But for the audience, guys, I hope you enjoyed this episode. Make sure that you go ahead and send some comments out there. You know that if you put your comments down, I'm going to respond to them. If you want to reach out to me, just go ahead and find the Burning Bear, send me a message. Email address and everything is out there for you guys. But I appreciate every single one of you. And just a tip like usual, if you don't want to miss the episodes, make sure to click that notification bell so that you're notified when we have episodes drop. I've heard a little birdie tell me that eventually this is going to get a little bit more regular, but we are working and ironing those things out as we conceptualize the direction that we are heading. So I appreciate your guys' patience, and as always, I am grateful for you. And I hope that you continue the storytelling in your own lives, and you can help others grow and heal. And like Dr. Zand said, spread love. Be generous, be kind, fill that cup up for someone else, and it will fill yours up too. So for this episode and for the Burning Bear podcast, we are out.